Hello guys, so our today's topic is Graves' disease, prepared by the batch 2023-24, roll numbers 126 to 150, under the guidance of Dr. Mahesh Babur sir. Physiology Department, Shri Mpsmc Medical College, Jamanagar. So let's start with the basic introduction. The Graves' disease or the Base-Dows disease is the most common cause of hyperthyroidism. It refers to an increased secretion of thyroid hormones. It is a chronic disease which may last for few years or can be lifelong. This condition is more common in women under the age of 40. So we'll look at the causes or etiology. It is an autoimmune disorder characterized by the development of thyroid stimulating antibodies against the TSH receptors, also called the long-acting thyroid stimulator. These antibodies bind to the TSH receptors and mimic the TSH action on thyroid growth and hormone synthesis. The entire thyroid gland undergoes hyperplasia as a result of autoimmune stimulation. So, we look at the signs and symptoms. We look at these one by one. The general features are a marked increase in BMR, weight loss, and increased heat production. The risk factors of Graves' disease include family history, and because of a family history, Graves' disease is known risk factor. There is likely a gene or genes that can make a person more susceptible to the disorder. 6. Women are more likely to develop Graves' disease than men. Age. Graves' disease usually develops in people before the age of 40. Emotional or physical stress. Stressful life events or illness may trigger the Graves' disease. Pregnancy. Pregnancy or recent childbirth may increase the risk of disorder. Smoking. Cigarette smoking, which affects the immune system, increases the risk of Graves' disease. The neuromuscular features are nervousness, irritability, restlessness, tremors of hand, and many more like muscle weakness, fatigue, heat intolerance, etc. The cardiovascular features include increased pulse rates and arrhythmias.
The GIT symptoms include diarrhea and steatorrhea, which is the abnormal excretion of fats, and vomiting. Then comes the dermatological features. Rarely, people with Graves' disease develop a condition that causes the skin to become reddish and thick with a rough texture called Graves' dermopathy or pretibial myxedema. Pretibial myxedema is a skin condition that causes plaques of thick, scaly skin and swelling of your lower legs. Reproductive effect. Too much thyroid hormone can cause irregular menstrual periods and make your periods lighter than normal. One may also get problems getting pregnant. Then comes the ophthalmic sign. Ophthalmological signs are lid retraction, producing staring look, and lid lag and exophthalmos, that is, bulging out of the eyeball. Exophthalmos occurs because of the proliferation of fibroblasts. Investigation. T3 and T4 plasma levels are elevated. TSH is low. Iodine 131 uptake is increased. Thyroglobulin antibodies may increase. Serum cholesterol is less. The treatments involve drug therapy, surgical therapy, radioactive ablation. Drugs therapy, beta blockers, propranolol, atenolol, etc. They do not inhibit production of a thyroid hormone, but they block the effect of hormones on the body. Antithyroid drugs. They block the iodination of tyrosine, preventing synthesis of thyroid hormone. Surgical and radioactive ablation. Surgical iodine therapy. With this therapy, you take radioactive iodine by mouth. Because the thyroid needs iodine to produce hormones, the thyroid takes the radioiodine into the thyroid cells and the radiation destroys the overactive thyroid cells, active over time. Definitive therapy is either surgical or medical ablation of all thyrocytes. The options are radioactive iodine or thyroidectomy, which is the removal of the thyroid. After ablative therapy, thyroid hormone replacement is provided to control hypothyroidism. And lastly, exophthalmos. It occurs due to swelling of extraocular muscles and proliferation of connecting tissues within the bony walls of the orbit that pushes the eyeball forward. And hence, this is how we conclude our presentation. Special thanks to our Dean Ma'am, Dr. Nandini Desai, and the Head of Department of Physiology, Dr. Nileshwari Wala Ma'am, under the guidance of Mahesh Babur sir. Thank you.